I know what I want, and I know what my vision is. I mean, I just need the doctor to do what they've trained to do, which is dissection.
That's an oversimplification.
I'm Justin Jedlica, I'm 32 years old, and I'm a living doll. I've had 125 procedures. And it's been $158,000 to make me really resemble a doll.
He had over 120 procedures to make him look like a Ken doll. Now, if I picked a doll to look like, I think I'd pick He-Man. That would be the one I'd pick, not the Ken doll, for God's sakes. The He-Man doll.
Chest was first, then moved on to bicep implants, tricep implants.
If you're a plastic surgery aficionado, you may think that bicep implants and tricep implants and pec implants are really common. They actually are not. These are not common operations. The vast majority of plastic surgeons don't perform them, but Justin has found somebody who's definitely done a lot of them for him.
A brow bone shave, I had a brow lift, and I started having a couple other nose revisions. I think I'll get a little fuzzy after a while, but at the end I've had 5 nose jobs now.
5? Nose jobs, otherwise known as rhinoplasty, is an operation where you typically lift the skin off of the nose and then reshape the cartilage. It is one of the most commonly performed cosmetic operations and the most common cosmetic facial operation in men. It's also one of the most difficult cosmetic operations that we perform, and it has a high revision rate. Now, my concern with Justin having had 5 nose jobs is that every time you cut into the nose and you lift that up, you create scar tissue. Justin's nose actually looks pretty good right now, but it could just be one more operation that could set him over the edge and cause the nose to look just scarred and really unnatural.
I realized that I had a liking for some more exaggerated features and this ideal male physique, you know, a little bit more like a doll, like a hero, you know, this like tiny waist and this large upper body.
He wants to be like a real-life superhero. The problem is that Justin is creating this physique using implants. And implants are not real, they're not real muscle, and so even though he may look like he has big, strong muscles, his muscles underneath those implants are probably anything but. If anything, putting implants like that can disrupt the normal musculature, potentially in the normal anatomy, that he may actually be weaker than the average man.
Now, I'm developing a customized muscle enhancement implant line at this moment, playing around with the shapes to get an idea of the custom implants I want to have made for my next surgery.
What is he, an implant scientist? There are certain patients who have certain types of birth defects, like there's a syndrome called Poland syndrome, where part of the chest, the side of the chest, may be missing. In those situations, sometimes we will create custom implants to create better symmetry for a person's body. But I have never, ever heard of a patient creating their own custom implant. That just is really out there.
I started my plastic surgery journey at 17 years old. And I had made the decision to fix my nose. After my first nose job, my surgeries became more of a creative outlet.
So we definitely need to talk about body dysmorphia, or body dysmorphic disorder, otherwise known as BDD. BDD is a psychiatric condition where a person looks in the mirror and what they see is different than reality. So for example, a person with BDD may have a little bump on their nose, but to them that bump is the size of Mount Rushmore. You and I may look at it and see a little bump and tell them, hey, it's just a little bump, it's not a big deal, but to them it is huge, and they can't understand why other people can't see how huge and hideous and deformed it looks. And this is really unfortunate because a lot of patients who have BDD or body dysmorphia, they undergo a series of cosmetic operations as an attempt to correct a deformity that was never even there in the first place.
So like when you look at this implant piece, this is only 2 centimeters in height, and my implant piece is basically a 4. Eventually, we'll have Justin implants for everybody.
This truly is a strange addiction because I've never had a patient truly go into the science of creating all of their own implants to make their own look. And to most plastic surgeons, having a patient come in like that would be a red flag because the #1 thing we want to do is make our patients happy. That's why we do this. And when you've got a patient like Justin, their big question is there anything you can do that will actually make him happy, or is there always going to be that next procedure down the line? Are you like the millions of people who have a bathroom filled with half-empty bottles and tubes of skincare? They may have promised to reduce your wrinkles, lighten your blemishes, and help you feel better about your skin, but none of them actually worked. Well, I've got the answer for you. It's called Youn Beauty. Youn Beauty is one of the only skincare lines that combines natural and organic ingredients with the latest and scientifically proven components like vitamin C and retinol. I'm so certain that you'll love Youn Beauty products that we offer a 30-day money-back guarantee, no questions asked. Head to younbeauty.com and use the coupon code 20OFF to get $20 off your first order over $99. I'll put a link in the caption below. Once you try Youn Beauty products, I bet you'll throw away your other skincare products and start loving your skin again. Thank you for putting your trust in me.
So I was thinking it might be good if I looked into like just enhancing my eyes a little bit, maybe doing a little bit of permanent eyeliner.
What?
My mom and me have been best friends ever since I was a little kid, and whether or not she agrees with my surgeries, she's always there.
Justin, you're gonna end up looking weird.
Now, in Justin's case, the good thing is that he appears to be relatively satisfied with the work that he's had done. He wants to have more done, obviously, but the work that he's had done, he's not horribly disappointed in. He's not complaining about it, so that's good. Where body dysmorphia patients can really have major issues is when they do undergo these operations, they don't get the result they're looking for, and they become really depressed about it. And unfortunately, BDD patients do have a very high rate of suicide and suicidal ideation.
Hey, Justin,
Dr. Hayworth.
how can I help you today?
I get to be my own canvas, and I get to create what it is to make me really resemble a doll. Well, I've been thinking about ways to augment my abdominal muscles.
Did you see Dr. Hayworth's face? Oh my gosh. Well, one interesting thing that has come around in plastic surgery is that we can now enhance muscles without exercise. There are devices that are being used today. We have one in my office right now, and they are used to cause your muscles to contract upwards of 20,000 times over a half-hour session. And these devices can create enhancements of the muscle and even reduce fat, and those results can last upwards of 6 months or so. A second option is to do fat grafting along with abdominal etching. There are some doctors who are injecting fat around the areas of the muscle and even into the muscle themselves as a way to cause the muscle to get larger. You can combine that with liposuctioning around the edges of the muscle called abdominal etching, and this can create a more defined appearance.
I always get a little bit apprehensive when I have patients that come in and they've had multiple procedures. They generally are seeking something that is perhaps unobtainable.
The number one reason why I turn down 1 out of every 5 or 6 of my patients is because of unrealistic expectations. They're looking for something that I may not be able to give them. In Justin's case here, he is so precise with exactly what he wants to look for, that in and of itself is a red flag. One of the things I tell my patients all the time is that plastic surgery is not like carpentry. You can't measure it by the millimeter and it fits perfectly and will always be like that. The body itself doesn't heal that way, and it's not that exact. And therein lies a challenge if you've got somebody like Justin who's very precise and exact about what he wants. It is very unlikely that any plastic surgeon, even the best in the world, is going to be able to give him that exact result.
I think you really want super perfection.
Correct.
I'm a plastic surgeon who sees a lot of stuff. With all due respect, you are conforming to common dictates of taste, but cartoon versions of it.
One of the features of somebody with body dysmorphia is a lack of insight. They typically don't know that they have body dysmorphia. Well, in Justin's case here, he did admit that he has kind of this super perfectionist outlook of what he wants to look like, and he knows that, and that's the first step with dealing with body dysmorphia, hopefully in a healthy way.
I know what I want, and I know what my vision is. I mean, I just need the doctor to do what they've trained to do, which is dissection.
That's an oversimplification. As a plastic surgeon, This is my nightmare. To have a patient try to control their surgery to that extent is just not possible. If things go wrong, which they can go wrong, you can get infection, you can get bleeding, you can get scar tissue, the implants can move out of place. There's so many things that can go wrong. Now you can get into a very uncomfortable position, maybe of Justin being upset of why did you not give me what I wanted, when what he wants is unattainable from the beginning.
I have to think about this because you do understand that these are all prone to complications.
What I sort of go with my motto is, if you can't give me what I want, then tell me up front and be up front, and I'd rather say, peace out, I'll do my own thing. And I'll find somebody.
And that's typically what happens, is that somebody has unrealistic expectations of what they want. A doctor who is reputable, who is giving them honest advice, says no, and then they go to the next doctor, and at some point, somebody will do the operation. Unfortunately, that operation often will then get botched because it was not a good idea in the first place. And then what happens? That patient goes back to that first doctor because that first doctor, that the patient realizes, wow, that doctor was telling me the truth. That doctor was actually trying to look out for me. Now maybe that doctor can fix me up. And this is something I see in my practice, unfortunately, all the time. While Justin's addiction to these body-altering surgeries is definitely a bit on the strange side, there are a lot of stranger things that happen on this show. Can you imagine somebody who is addicted to drinking blood? Like, we're talking liters of blood every day? Or maybe somebody who's addicted to eating plastic bags? Well, I count down and react to the 4 worst eating addictions from my strange addiction on this video right up here. They are going to blow your mind. You will be shocked at what people are putting in their mouths. And if you've been enjoying my videos, please subscribe to my channel, and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.